Hi, I'm Lisa Ackerman. Boy, do we have a treat for you today. I am interviewing one of my most favorite people, Dr. Daniel Amen. I am so grateful for you and all that you do. And here we are doing our distance instead of in-person interview. And I just really appreciate you taking the time today. And gosh, we want to explore the ideas of strategies for families living with autism during this COVID time. I don't want to call it the new normal. I'm going to just call it this phase. And I really appreciate your dedication to mental wellness for people. So thank you. Thanks for joining me.
Always great to be with you.
Yeah, I love it. We've been friends for what, 15 years?
A long time. Been through a lot together.
Yes, we have. And I appreciate you personally taking care of both my dad and my son. My dad's 92 and moving and grooving still. And you've been very helpful to our family. So thank you. But for folks watching, why don't you tell them a little bit about yourself and your background?
Well, I'm a troublemaker. I've been a troublemaker since I was a child, if you ask my dad. I was an infantry medic. That's where I fell in love with medicine. Then I became an X-ray technician, which changed my life because our professors used to say, how do you know unless you look? Went to medical school. Someone I loved tried to kill herself, took her to see a wonderful psychiatrist. And I came to realize if he helped her, it wouldn't just help her, that ultimately it would help her children and even her grandchildren as they'd be shaped by someone who's happier and more stable. So about 41 years ago, I fell in love with psychiatry and really have loved it every day since. But I fell in love with the only medical specialty that never looks at the organ it treats. You know, most people get a diagnosis of autism. No one has ever looked at their brain. And I just thought that was insane. And so ever since I was a young psychiatrist, I'm like, we should look. How do you know unless you look? The brain is an organ like your heart is an organ. And I never really got the brain-mind dichotomy. You know, when neurology and psychiatry got divorced, neurologists got the brain, psychiatrists got the mind, and I actually think they got ripped off because the brain creates the mind. And so in the late 1980s, we started looking at the brain first with this study called quantitative EEG, which looks at electrical activity. And I loved it. I thought it was so helpful. And then in 1991, we started using brain SPECT imaging, which we use in all 8, soon to be 9 clinics around the country. And it measures blood flow and activity. So I'm famous, or often infamous, because I think psychiatrists should look at the brain before they make a diagnosis like bipolar disorder, schizophrenia, depression, autism. Because how do you know really the underlying biology unless you look? That making diagnoses based on symptom clusters with no biological data is just dumb, especially in today's world where we can look at the structure, the function, blood flow, electrical activity, and so on. And it taught us autism's not one thing, that it's a bunch of different things. Sometimes it's toxic, sometimes it's traumatic, sometimes the brain's inflamed. And if you don't know, you end up doing the same thing for everybody, which helps some people but makes other people worse.
Yeah,
So I'm also an author. I've written way too much, but I have a new book out called The End of Mental Illness. I'm really proud of. It says the same argument. These things aren't mental illnesses. That shames people, stigmatizes people, and it's wrong. I mean, calling somebody mental is not a good thing. Call somebody a brain, and that's a very positive thing. And these illnesses are not mental illnesses, they're brain health issues. Get your brain right and your mind will follow.
I love that you look. Thank you for looking. I appreciate that. So how did you get into autism? I mean, what brought you, do you remember when you started there?
So when we started looking at the brain, autism was still 1 in 10,000 kids diagnosed. Although many of those kids were getting a mental retardation diagnosis that was popular back in the late 80s. But it just seemed in the early 90s that I started seeing more and more kids. And then by 2000, we began to see a lot of kids. And they were often the ADHD kids made worse by stimulants who didn't do well socially. Their language was not great, and they were obsessed by whatever. And the more I learned about it, the more we started to look at it. We just published a study on 1,000 autistic kids, and we began to see a similar pattern where their cerebellum was smaller, especially the vermis, that's the middle part of the cerebellum, and their frontal lobes were busier, almost like an OCD pattern. And so that's sort of the classic spec pattern with autism. But then, of course, when there's a classic pattern, that means there are probably other patterns too. And it's just become a very important part of what we do.
I'm grateful you do it. So thank you. And if autism wasn't complex enough, let's throw in the coronavirus that we're experiencing right now, which is, I mean, our support is up. I would say most of our programs on average are up over 40% since the start of the pandemic. And today I really want to give families some strategies and tools. And we're going to talk first. What are you seeing with patients with autism right now during this coronavirus pandemic?
Well, if you already take someone who can be obsessive, I think too much information will make them more obsessive. I mean, yes, of course, you want good hygiene, but no one's talking about the products you're washing your hands with may in fact be toxic. Whatever goes on your skin goes in your body and affects your body. So right away, simple tip, download the app, Think Dirty, and then start scanning all of your personal products and what you put on your skin or what you put on your hands. And it'll tell you on a scale of 1 to 10 how quickly it's killing you. And so, like my body wash, for example, I used to like soft soap. And on a scale of 1 to 10, it's a 9, 9 being bad.
Yeah.
And so now I get something off Amazon called the Lafia that's a 2. And it's really not much more expensive, and I'll have fewer medical costs. So watch what you put on your body and the bodies of your children. Children are like violins in that they play the stress of their moms and dads. And when the pandemic first hit, for me, it was March 10th. My book, The End of Mental Illness, came out March 3rd, and I'd been running around the country on a book tour. And I was going to head to New York to do the Mel Robbins show. And I'm in my bathroom getting ready to go, and the producer calls me and says, "Don't come, they just closed the studio." And I'm so grateful I didn't end up in the epicenter of COVID-19 in the middle of March.
Oh boy.
But that night I wrote down mental hygiene is just as important as washing your hands. We need to disinfect our thoughts, kill the ants, the automatic negative thoughts that steal our happiness. And so modeling mental hygiene by not saying things like it's always going to be this way or everyone is irresponsible. And resilient people, they have what I call a TLC pattern. They see this pandemic as temporary. This is going to go away, right? Think of the prisoner of war. I was an army psychiatrist and I treated many of them, but some of them were prisoners of war for 7 years and they came home, right? Because they saw it, this is not going to last forever. When you think it's going to last forever, it just runs you over. So temporary. Local. And yes, it's a global pandemic, but it's really happening in your neighborhood. So
Right.
what is it that I can do to stay safe in my neighborhood? It also means you need to turn off the news, because the news is not the news. People don't understand that. The news is not the news. The news is clickbait. And they are trying to get you to click or stay watching for their advertisers. So they don't present it in a balanced way. Whatever leads, bleeds. And so turn it off. 20 minutes a day, look at the headlines, and then turn it off. You know, whether it's CNN or Fox or MSNBC, they're all equally at fault with this. So temporary, local control. What can you control?
Right.
So goes back to the serenity prayer, which
God, give me the strength.
to
Uh,
accept the things I cannot change, the
yes.
courage to change the things I can, and the wisdom to know the difference.
Difference.
And so wear a mask. And I know Taka has resources for when kids have to wear a mask. And there's a lot of noise out there. You know, I hear it among people I know, oh, it's not that serious if you're young. And I'm not convinced. The autopsy studies that are coming out show in affected organs, lungs, liver, kidneys, and the brain, they have these thousands of little tiny micro blood clots, that there's something with clotting factors in COVID-19 that are not good. And about 30% of patients end up having nervous system issues. And we have scanned a number of people with COVID-19. And so far, it's not something I want. And I'm not going to a COVID party. And I don't think you should go for a COVID party either. And I just have this sneaky suspicion this is going to end up like Epstein-Barr, herpes, Lyme, that people can be infected. They might not have any symptoms, but it can reactivate itself later. So I think we need to be thoughtful, careful, and your best defense is your immune system. So strengthening your immune system and your child's immune system. And, you know, one of the reasons I really became interested in autism is one of my parents, and I've learned most of what I know from the parents, also from Taka, also from our scans, is that when she put her child on a milk-free, wheat-free diet, he picked up 50 words in 1 week. And so make sure your diet's right, you're optimizing your and your child's vitamin D level. Normals between 30 and 100, something like 70% of the population is under 30. I like to keep mine about 80, but you should test it and take vitamin D. I actually think the whole world should take about 2,000 units of vitamin D a day.
That's amazing. And there's so many, like when we tested my vitamin D when Jeff was diagnosed and when his vitamin D, we were single digits.
Which just increases your risk of every bad thing.
Exactly.
And so if you're going to go to war with COVID, go to war with a vitamin D level that is good.
Yeah, exactly. So that's such good information. I think one of the things that we're not hearing in mainstream news, and I'm glad you're sharing, is you've got to build a proper, defense, have your immune system build up and be strong. And you talked about diet, you talked about supplementation. Talk to me about exercise. Where's that in this equation?
Especially for autistic kids, coordination exercises. Their cerebellum's already often weak. And so you strengthen that by getting them to move their bodies, whether it's dance or table tennis or a treatment I like called the interactive metronome. Those can be things to activate the cerebellum. walking like you're late. I actually start every day. I have 2 huddles with my teams at Amen Clinics. They last about 40 minutes, and I'm walking the whole time because that's how I get my exercise in. But if you can just make sure walking, some sort of racket sport, if you can do that, dancing, just a great way to start the day.
That's so important. And I know when this all started and my mind was doing some ants and getting negative, and I think of you often when I start that process and I would say, well, what would my friend Daniel say? And Daniel would say, stop doing that to yourself. Push those thoughts out. And
I have this kids book,
oh, you do? That's right. I love that book.
Captain Snout and the Superpower Questions.
You
A
did.
lot of the autistic kids have read it actually about 800 times. And um, it teaches you not to believe every stupid thing you think.
Right.
Um, this is the mental hygiene part.
Right.
Whenever you feel sad or mad or nervous or out of control, write down what you're thinking. And then ask yourself, is it true? Can you absolutely know if it's true? Learning how to question your thoughts and not believe every stupid thing you think is critical to disciplining your mind. Watch your thoughts and you'll go, well, that's a crazy thought, or that's an irrational thought. And no one ever taught me. I have 25 years of education. And it wasn't until I became a psychiatrist that I learned this technique called CBT, cognitive behavior therapy, where the therapist would go, you don't have to believe everything you think.
Right.
And I'm like, they should have taught me that in 2nd grade. It would have saved so much suffering.
Yeah. And to add to that, so besides getting rid of the ants and eating healthy, I upped my exercise. So it's 5 miles a day I commit to, whether I walk, run, or both, and planking. So whenever I get a bad thought, I plank. So guess what? I stopped doing it because I don't like planking.
So good for your core.
I know, but 2 minutes a day is what I can do. But that's how I got myself to stop having those negative thoughts. And whenever kind of heard you in the back of my head, well, if you're going to do that, you better plank it out. So literally people would walk by my office and see me planking.
Another way to do it is just write it down.
Right.
Like if I get a thought, Tana, my wife never listens to me. I've had that thought. And I just write it down and I'm like, is that true? And I'm like, I'm actually working now on my 15th public television special.
Wow.
About the brain, on overcoming anxiety, trauma, and grief, sort of appropriate for the times. And she's listened to all of them. She's actually going to be in this one with me. And it's just a bad thought, but unless you question your thoughts, you believe them. And even if they're lies, you act as if they're true. So if I just had this thought, she never listens to me, well, that would make you feel terrible. You married her, you gave her your life, and she's never listening to you. It would make you feel lonely and angry and sad. It would actually give me permission to be rude to her, and based on a lie. But when you question your thoughts and then you go, so what's the goal? Kind, caring, loving, supportive, passionate relationship with that woman. Okay, being rude to her doesn't fit your goal. So managing your mind just helps you so much.
Right. And I appreciate that. So we talked about diet. So maybe not eating so much bad junk food, maybe eating.
Or any. Why would you eat things that, I have this saying when it comes to food, that I am only going to love food that loves me back.
Right.
That I don't know if you've ever been in a bad relationship, but my first marriage was bad, 20 years, and I'm persistent. And when we got divorced 20 years ago, my goodness, it's been a long time. I told myself if I ever got married again, one, I would scan her, that was the first naked part of her I wanted to see. The second thing is I'm only going to love somebody that loves me back. And why would I do that with food? I mean, why would I love food that damages me, that increases inflammation or increases the risk of obesity, diabetes, heart disease, cancer? No, that is not the sign of intelligent life. And people go, oh, well, that must be boring. I'm like, no, being sick is boring. Being in pain is boring. Being fat is boring. No. And I love the food I eat, and it loves me too.
Good idea. So I just wanted to touch on diet, exercise. Let's talk about supplements. You talked a little bit about vitamin D as being crucial right now. What other supplements are important in this phase?
Well, so I think for anybody under chronic stress, it's really important to have a good multiple vitamin, especially one high in the B vitamins, because they help you manage stress. Um, and I think you should also not go on a low fat diet because cholesterol, the mother hormone, helps you to make stress hormones, but it also makes sex hormones like testosterone and estrogen and progesterone. And so, with the chronic stress of the pandemic, even though you have more time for sex, a lot of people aren't having sex because it's everything going to cortisol. There's stress hormones. So don't go on a low fat diet. Multiple vitamin fish oil. 98% of the population is low in omega-3 fatty acids. And then it really depends on your brain type. We have a free brain health assessment test. You can know which of the 16 brain types you have. And then based on that, do you need supplements to help you focus? Do you need to help so you don't worry, so they can support your mood? Since we've talked last, we have a new supplement at BrainMD that I love called Happy Saffron. It's made with saffron, curcumin, and zinc. Three things to really help support your mood. But I've been following the research on saffron for about 15 years. Not only does it increase mood, it's 21 randomized controlled trials head-to-head against Prozac, Zoloft, Effexor, Celexa, antidepressants showing it's equally effective. But rather than steal your sexual function, which the SSRIs can do, it enhances sexual function. And our first 4 testimonials were Viagra for women. So we're actually doing a study now on female sexual function and Happy Saffron. And when the pandemic first started, I'm like, this is going to be a stressful time. So I started taking Happy Saffron, and then I slyly convinced Hannah to take it as well.
You're like, that's awesome. I found ashwagandha helpful during stressful times too. Have you found that to be true?
I love ashwagandha. It's actually in our focus and energy formula because it helps people focus and it calms them at the same time. Too many people, when they feel tired, they reach for caffeine, but caffeine can make you focus and a little agitated as well. Plus, it's addictive and it creates withdrawal. So, I mean, you and I have had this discussion. So, I like ashwagandha. I also like theanine. I think of theanine as really one of the great supplements because it can help you feel calmer, but also more focused as well.
Yeah, believe it or not, I think I should take a bath in ashwagandha every day, and I'm definitely taking my fair share. Same with my family, just to keep our mood back up. So I know you mentioned medications, and you talked a lot. I think it's important to know, start with supplements first before you go the medication route, if possible. When do you deploy medications in times like these?
So if someone's schizophrenic or they have brittle bipolar disorder, I usually start with medication because I don't have supplements that will get those two things under control. Now, at the same time, I'm also going to support their brain with supplements, diet, and exercise. But for virtually everything else, including major depression, I start with supplements and lifestyle interventions, diet, exercise. I'm a huge fan of saunas and hyperbaric oxygen treatment, depending on what I see in the scan. And, you know, if 4 or 5 tries and I'm not getting it, then I'll start thinking about medication because I'm not opposed to medicine. I'm just opposed to that's the first and only thing you do. In the End of Mental Illness, there's a chapter called Mind Medicine versus Nutraceuticals. And I look at schizophrenia, bipolar disorder, ADHD, depression, anxiety, insomnia. And it's like, okay, before medication, here are 10 things to do. And often it involves just getting your habits right and getting your nutrition right.
Oh, that's such great. And you talked, I appreciate that because I feel like a lot of people will jump that step without addressing the other things first. And they're all so important to go in harmony, for your body to be in harmony. So we talked briefly about cognitive behavioral therapy. Is there anything else behaviorally support wise we can do during this time period?
Well, there's another thing I like. It's a new term I came up with, positivity bias training. When we test people, we'll get a positivity bias versus negativity bias score on them. And so many of my anxious and depressed patients, their negativity bias just screams, and it's bad for them. Now, I'm not the optimist because the don't worry, be happy people, they go to COVID parties. They're the ones that die early of accidents and preventable illnesses.
We don't want to do that.
So I think of myself as a realist, but I want to bend more toward the positive. So I start every day when my feet hit the floor in the morning, today is going to be a great day. And then my unconscious mind finds, why is it going to be a great day? I get to talk and hang out with you today. So that makes me happy. And with the kids, start training them by breakfast. Go, so why is your day going to be a great day? And before you go to bed at night, and I've done this every night during the pandemic, I say a prayer and then I go, what went well today? And I have to find at least 3 things. And this pandemic's not been the easiest time for me. Early on, you know, I have 8, soon to be 9 clinics. I have a clinic in Manhattan at the epicenter of it. And one of my young employees, so people think the young don't get it, she was like 28, ended up on a ventilator for 6 weeks. And we had to close the clinic. And then my mom got COVID. My dad got COVID. My sister got COVID. My mom got better. My dad really didn't. And a month later, we lost him. But even that night, because it's a practice, right? I mean, we all have habits. Are they good habits or are they bad habits? Even that night, I said a prayer and I went, what went well today? And a lot of things that day didn't go well. But I must have gotten 500 texts from my friends, from his friends. So, I mean, he was obviously deeply loved by a lot of people. And the police officer was great. The paramedics were awesome. I could just go through that day on what went well. And I just slept like a baby that night. And it doesn't mean I didn't miss him or I wasn't sad for him, but where you bring your focus always determines how you feel. And what most people don't know is 8 families out of 10 are closer than they've ever been because of the pandemic. That too often, with two-parent working families, that bonding between parents and children has been stretched beyond what is probably good for children. And the incidence of mental health challenges have really skyrocketed in the last 3 decades. Now, parents have more time than ever. I mean, I noticed it at home. I have a 16-year-old daughter and 2 nieces that live with me. I mean, we're having more dinners together than ever before. I mean, we literally have more time together, and there's going to be a generational positive impact on the level of bonding that has occurred between parents and children, I think, than ever before.
Oh, thank you. And I'll put the notes with your 2 books that are recent. And I found if you need help on the positive side, the 5-minute journal is really a great, it guides you through how to be positive. And I really love that journal. If you can't find a way, it helps push your way and get your line of thinking. So we'll put that in the notes so people have some resources because it's so important. So sorry about your dad, but appreciate, that you were able to find a way to look at how many people loving him and being positive around, your experiences with him and all that. So I'm just so sorry. But to shift gears, do your clinics right now, are you doing telemedicine to help families during this tough time if they need some support?
So we've been open the whole time.
Right.
And we're still doing scans at all of the clinics, and most of the doctors are seeing people virtually. And telemedicine, we've been doing telemedicine for almost 30 years, so it's not a new thing for us. But now, the laws changed. We made 10 years of progress in the month of March, just because of what happened with the laws. And so, we can see people virtually, prescribe medicine virtually, which you couldn't have done before. And I actually don't think we're missing all that much by not being able to see people in person.
Well, I'm glad you're a resource there for families. So thanks for staying so strong. And I mean, we talked about a lot of things. Is there anything you want to add on tools and tips for families?
Well, I think any family that has a child with autism or a developmental delay, it is so stressful. You really have to focus on taking care of yourself, because if you're not good, nothing's going to be good. And the times when you get angry, when you get upset, it's often when you didn't sleep or when you didn't eat right or take care of yourself. So Swear Talk is just so good to be a support for you. So make sure you support Taka so they can continue to do the work that they do. But you have to really work to take care of your own brain health, because without you being good, everything else is not good.
Amen. And I appreciate that. And we have, I think we've updated 40 articles on the TACA website that will help families during this time period and beyond. We have tools like the mask and the social stories and that. We'll put that up there. And really just know that this too shall pass. We won't be stuck in this phase forever. And, having friendships and people you can count on. I do a lot of Zoom calls. Jeff, my son, who's 23, is doing a lot of Zoom hangouts, playing Jackbox games with friends. Staying connected even though you're socially distanced is something you can do. So thank you. I appreciate you and adore you. Sorry I can't hug you right now, but just want to thank you for being such a great resource for our families. And thank you for giving us some tools and tips for this phase we're going through. So thank
I
you.
look forward to seeing you in person or the next time we see each other over video conference.
Yeah.
You're very special to me.
special to me too, and I'm really grateful for all that you do. So thank you for joining us, and we'll talk to you soon.